This is the video for arterial blood gas sticking, and we're going to go from beginning to end. First of all, before making an arterial puncture, we have to have an order. I would have an order from the doctor indicating what settings the patient needs to be on, whether oxygen or air. If it's oxygen, what liter flow. I would go to the floor of the patient's room, check it in the chart, make sure this and the order from the doctor correlate with each other. I would then go into my patient's room, identify my patient with wristband, date of birth, and I would make sure that the appropriate oxygen and or air settings are applied. If it's a COPD or any other pulmonary disorder that the patient has, I would have made sure that the settings have been applied at least 30 minutes. For example, if they were supposed to be on room air, that they were at least on room air and not oxygen for at least a half hour. Normal patients, that's anything that doesn't involve pulmonary status, I would only have to wait 20 minutes. And then, after doing that, I would explain to the patient why I'm here, what I'm doing. I'm here to get a blood gas. I explained to them that it's to check their oxygenation status. And after that, before actually making the puncture, I would make sure I had all my equipment, and then I would perform an Allen's test on the patient. Now, an Allen's test is to assure collateral circulation on the patient's arm. We're doing this just to ensure that we have a second route of blood circulation to the hand in case anything were to happen to the arterial artery during the puncture.
The modified Allen's test consists of grabbing the radial artery and the ulnar artery, occluding them, having the patient make a fist and let loose, make a fist, let loose, and I would let loose the ulnar artery and make sure the hand pinkens back up immediately.
And as said before, this ensures collateral circulation just in case we were to damage the radial artery to a point where there was no blood flow through it going to the hand. Alright. After the Allen's test, we will go ahead and open our ABG kit. Needs to definitely have a syringe, a biohazard bag, one or more needles, most of them come with at least 2, gauze, an end cap for afterwards, patient identification and information slip, Band-Aid, alcohol, and iodine. We need to palpate for pulse, a radial pulse to start with, make sure we can identify the spot. Then we need to sterilize the site. We start with the iodine. Start in the center of where we identified a radial pulse at. In a circular motion, work our way out. Discard that. Following the iodine, immediately use alcohol. Same motion. Center where we identified a pulse. Circular motion working outward. Discard that. Now we are ready for the actual puncture itself. Safely removing the protective cap and leaving the needle in the syringe. Well, I'll just use a different one. And then palpate for a pulse once more, just to assure that we have accuracy. Inserting the needle at a 45-degree angle, bevel side up on the needle. Technique is optional, whatever best fits. Just make sure that you have the hand braced in case the patient were to jerk. I like to place my thumb on the palm of the hand while palpating with the index and middle finger, and then notify the patient this will be a stick. Slowly inserting, letting the needle fill, course, we would have pressure that would be filling it. And then with the other hand grabbing the gauze, applying pressure at the puncture site, slowly withdrawing, capping it with the safety feature. These are all different depending on what kit your hospital or facility uses. Laying that to the side, holding pressure on the site for at least 5 minutes. This is to ensure coagulation of the arterial artery. We do not want to prematurely stop holding pressure because we may have continued bleeding at the site. It could form a hematoma or prevent proper circulation after the puncture. For an experienced person, we can roll the needle. Needles are heparinized. Mix the solution, the heparin solution. We will remove the syringe itself. Push all the air out, like so. And then cap the sample. Placing it to the side. 5 minutes later, we can remove our gauze pad. If it has stopped bleeding and there's no visual blood from the site, we're good to go. If not, we can apply pressure for another 1 to 2 minutes until it has stopped, and you must repeat until the bleeding has actually stopped visually. After that, we take our Band-Aid. Careful to remember not to apply the Band-Aid with the gauze underneath over the site. We do not want to actually tape the gauze down. We want to use the Band-Aid and the Band-Aid only on the site. Apply it. Fill out our information slip. You must have two. One for the actual needle. The syringe must be labeled itself at most healthcare facilities. These regulations can differ from facility to facility. And one label for the biohazard bag. The biohazard bag, which was not mentioned earlier, should be prepped with ice and water, a slush solution. You would label syringe, label bag with the proper information. Put the syringe in the bag, which would have the water and ice mixture in it. It must be transported out of the room like so, all the way to the lab, no exceptions. And that is the arterial puncture.